I call Hūhana Lyndon.
Tēnā koe, Madam Speaker. On behalf of the Green Party, I rise to speak on this piece of legislation that, strangely, we support as well. And we have many things that we have concerns about, but for this, we do agree that access to medicines is important. And when I think about the challenges for Māori in access to vaccinations during COVID, and the fact that, inequalities did exist and the inequities were there because we couldn't access the relevant medications, these types of changes will help all of us benefit as Aotearoa New Zealand. I want to labour the point of support around how we can look at a multidisciplinary approach to the administration of medicines, and having nurse practitioners be able to work at top of scope for the delivery of medicines into community are important. And with this legislation, we are looking forward to what the select committee process will bring, as we will be encouraging iwi Māori, Māori providers, the various stakeholders to bring their voice into the select committee and inform the way with which we move forward as the House Select Committee. Cautious, as always, in terms of the way that we will look to analyse submissions as they come forward, because we are taking a safety approach and making sure that we do have the relevant safeguards in place. Patient access to medicines is important, but also looking at the wider health system, that we do have current barriers and challenges in the way that we need to take a population-based approach across the entire system. And so while we are looking at medicines in this part of the system, let's look at the entire system and the very deep challenges that we have within Health New Zealand, within primary care, and the way with which we deliver into secondary care as well. Now, medicines is only one part of that. Accessing medicines in a timely way is important, but if we can pull the ambulance back from the edge or the bottom of the cliff, then we can actually look to improve the lives of all New Zealanders across Aotearoa. Kia ora to my colleague Francisco, and I want to recognise the workforce that is coming from overseas to support us in this time of crisis. Our Filipino nurses and those who are clinicians that come from overseas, because those skills that we have from overseas, kaimahi that come to Aotearoa, support us, whether it's in hospitals, primary care, or in aged care as well. Now, when we think about this legislation and safeguards, the Minister does have a lot of power in this space, and us forming committees that are just through ministerial appointment also needs to be looked at through the select committee process. But the flexibility to be able to prescribe and to find medicines that have already been approved into other jurisdictions does provide some comfort and safety for us at this stage of the process. We do look forward to hearing from across the board in terms of community, patient voice, those who have been impacted in both the access issues and concerns as families and those who have sought care, but also those who are the prescribers. Can we find across the workforce their voice to come forward into the select committee process, because we want to have regulations that safeguard patient care, also safeguard the workforce and those who are the prescribers, to ensure that there are relevant protections in place, but also open up access to a broad range of medicines that maybe we have not had access to here in Aotearoa, New Zealand. On behalf of iwi Māori, we think that, we are heavy users in the system for health, whether it's Health NZ services, whether it is out in community health care spaces and primary care. And so, of course, we need access to timely medicines that this legislation can bring forth. So on behalf of the Green Party, we do stand in support and look forward to seeing what we can bring out in the House Select Committee process. Kia ora.